Good morning, everyone. A very warm welcome to Revive the Basics 2.0. This is session 5. And myself, Dr. Yamini Ramesh, I welcome you on behalf of Asha Homeopathic Academy and Homeopathy Junction. So, today we have with us a very special guest. I would like to introduce him and then we will start the session. Okay. So today's speaker is Dr. Shrikant Jumale, and he's a very, very good practitioner, very good friend of ours. And I'm so happy that he accepted this invitation and came today to share his rich clinical knowledge. And today's topic is also very contemporary topic because we all are dealing with acute cases and we always get stuck that how to deal with this. And I requested Dr. Shrikant to share something about chikungunya and viral fever, which is going on these days in all parts of country, and a lot of people are suffering from that. So he will be sharing cases and his insights that how he deal with acute cases. I have learned a lot from Dr. Shrikant from time to time. He keeps sharing some clinical tips about repertory, about synergy homeopathic. So to introduce him, though most of the people know him, I want to tell you that Dr. Shrikant has graduated from CMP Homeopathic Medical College, Mumbai in 2010, and he has learned under many stalwarts, mainly Dr. Sarkar in Kolkata and Dr. Rajan Shankaran in Mumbai. He's very closely associated with the Other Song International Academy, Mumbai, for advanced homeopathy, and he has completed various long-term courses from the same institute. During internship, he was house physician at Mumbai Devi Homeopathic Hospital, and he has rich experience in managing IPD patients as well. He has been practicing since 14 plus years now, and he's known to be very profound in his personal relationship. I don't think there is anyone in the homeopathic world whom Dr. Shrikant doesn't know, and that person would know the know Dr. Shrikant is so good at it. His friendly and easily approachable nature makes him very likable among his peers and colleagues. He has his own practices in Vasai, which is in Mumbai, Sabat, and Amravati city as well. And he sees patients online as well. So, Dr. Shrikant, warm welcome.
Thank you. Thank you very much.
Thank you so much. I'm really looking forward for this session. बहुत सारा आज सीखने को मिलेगा.
Yeah, yeah. Even I will also learn along from you people.
Thank you. That's so sweet of you. But I'm really looking forward for this session because practically मैं भी आपको बताऊँ तो acute cases में कहीं ना कहीं हमें थोड़ा सा difficulty आती है और especially अभी जो viral diseases, viral fever specially चल रहे हैं, they are very complex. मतलब होगा viral fever, but it will have a presentation of chikungunya or malaria or typhoid, but in test you don't see anything.
Yes.
But the presentation is overall all like mix of everything.
Even if I tell you this chikungunya and viral fever and dengue fever is very common nowadays in particular few areas. It's a
Yes.
kind of you can call epidemic or a sporadic kind of disease. But still, what I feel there is lot of scope of homeopathy to treat this kind of fevers. And the only thing that people are not aware that how homeopathy can help them in overcoming with dengue fever or the chikungunya fever or even a simple viral fever, and that's why we are lacking the opportunity to show to show the people or the community how important is the homeopathic treatment to overcome that fever. Like I will give you the example. I know most of the homeopaths they are treating their family members with homeopathic medicine. I am also not the exception. Especially for my daughter, she is 3 years old. She has not taken any medication, any syrup, or any even procin also we are not given to her. And with homeopathic medicine, she responds very well. That if with one dose, two dose, or overnight, she gets better.
Yeah.
And for long time she don't get any kind of illness or fever, which is exactly opposite what I see that my cousins they also have the babies 2 year 3 year 5 year 10 years, and they are very very much I said anxious also and worried also for their childs or children's, because they have to visit every month, every second alternate month, they have to visit the pediatrician and take lot of antibiotics and medicines and all. And when I explain them, this is the live example in front of you, and now they are willing to come and to take homeopathic medicine. So this is the, I think, this way we have to make the awareness how
Hmm.
important is the acute conditions, that we have to look for it, and that is the opportunity that we have to treat the patient with homeopathic medication.
Very true, very true. Because I have also seen ki if you give homeopathy to young children since
Yeah,
the early age or since they are born, their immunity is very good and they don't get such infections very easily. And even if they get, they are, the response time is very less in compared to other treatments.
definitely.
Yes. So,
Even in today's talk, I'm going to cover that a very special and important topic: how to make awareness, how to tell people that what is the benefits of fever.
wow, great.
So, okay, I think we'll start it
Yes,
without
yes.
wasting much time.
Yeah, yeah. Please start.
Should
Over to you.
I think I should share my screen. Is it?
Yes, you can share. I have allowed it.
I think you are able to see the screen,
Yes.
because that is important. Because what I will talk, the PPTs will be more expressive. Because when I speak, I may speak for sentences, but the PPTs will have a very precise points where you will get the compass where I am going and what I am going to talk. So welcome everyone for this session. And I am since beginning only, since my third year, final year, or internship, and even while I was doing a house physician duties at Mumbai hospital, the acute cases is the one which excites me a lot, because in chronic cases you have to wait to get the patient's follow up or the reactions, and then you will come to know your medicine is right or wrong, or is it going to do better, or patient is going to do better, or he will continue the medicine or he will discontinue the medicine. So chronic cases is the one where it's a different way you have to tackle the patient. But in acute cases, what I have seen, the acute cases is the most exciting thing, and the most easily you can see the results of homeopathy. So every acute case, it can be fever, it can be cold cough, it can be anyway, loose motion, diarrhea, it's very common. And there you will see the magic of homeopathy, how fast it gets better, the patient gets better. So what today we are practicing homeopathy is only because the Dr. Hahnemann has given us a lot of materials, lot of different laws, and he found a homeopathy, and that's how we are practicing it after even 200 years. So the main pillar to practice homeopathy is the knowledge of organon of medicine. Without it, you cannot practice. Then other is materia medica knowledge and the repertory. How to apply the knowledge of repertoire, how to use the repertoire is the very skill, or I say art of using the knowledge of your materia medica and organon and repertoire together. So without wasting time, I would like to continue with a quote of Dr. William Osler. He is a physician, and what he has said is very you you will say applicable to homeopathy. That what he says, the good physician treat the disease and the great physician treat the patient, and that's how what we are doing in homeopathy. We are not just dealing with the patients and the diagnosis of the disease, but we are treating the patient as a whole. We are understanding him with his past history, family history, his physical symptoms, his mental symptoms, and with understanding of all these, with his miasmatic background, and we are prescribing homeopathic medicine and we are healing the patients. And that's the, I would say, a complete science that we are practicing homeopathy today. And lot of patients, they need a homeopathic medicine, they need a good homeopathic doctors, But the only thing that we should ourselves should be very confident and know how to treat the patients. Yeah. So the acute disease, where I'm, yeah. So the acute disease from the Organon 6th edition, and even you can refer 5th edition also. Both editions are very, very important. So in the 6th edition, you will find what Dr. Hahnemann has said about the acute disease. I know, dear friends, this might you will feel that I'm taking or telling you about very basics, or I'm giving a references from Organon or Materia Medica or repertory, but this is very, very important. We should know the basic first. So acute diseases are the result of deranged vital force with the rapid morbid process, and there is a sudden onset with definite course and quick expression of action. For example, a patient is getting fever, so fever gets suddenly, it comes suddenly, like 2 hours before he was at normal temperature, and suddenly he gets fever, and then fever progresses with a definite course, maybe for 2 days, 3 days, 5 days, depend on the patient's immunity or the response of the patient's immunity to the fever or the infection, and then quickly express the action. Like in fever, he gets completely irritable, he gets completely dull, he might not asking for food, not asking for water to drink, and that is the change in him, and that's the change we have to observe, or that's the change we have to note it down and find the simillimum or find a remedy for this symptom. The complete change of symptom, what he was before and what he is now. That is the phase of between these two is very, very important to get the understanding of the patient's symptom and choosing the remedy for him. And that's how they terminate within a short time, either with complete recovery or the death of the patient. And most of the time, patient gets recovered with acute condition. But in few cases that I have also heard and I have seen, some patients they are not getting better and ultimately lead to the death. So this is the case of acute disease, where either you take a medicine or you don't take a medicine, you will get better. But that if you take the medicine, you will get better much easily without much harming to your vital organs. So what Dr. Hahnemann has classified the disease is very, very important. See, to treat the acute cases or to treat the chronic cases, you should know how Dr. Hahnemann has classified or how he has explained it with the vital force or vital principle. What he says, the illness is the derivation from state of complete physical, mental, and social well-being. When the patient is sick, he is completely deviated from his social well-being, from his physical symptom, and from his mental or from his mind state. So he has find there is a one disease called indisposition, where a patient is getting maybe heartburn or maybe indigestion because he has overeaten yesterday night or yesterday, and today is not well. He's getting discomfort, and maybe he don't need medicine sometimes, but instead he has to fast for another day or for fasting for next 8 hours, 10 hours to get him better, and that's the indisposition of the patient, indisposition of the disease, where patient might not require the medicine, only the some change in his diet or lifestyle will get him better or improve. Then surgical diseases where the vital principle is not affected, it is the external injury, or it gets affected, or the parts get affected by external obstacles or the external force, and we have to remove that surgically. Without that, we cannot cure the patient. Dear friends, please remember our medicine, homeopathic medicine, acts at dynamic plane only. It cannot act on surgical things or at the local physical. If the physical barrier is there, we have to remove it surgically. If someone gets accident and gets broken in his bone, then surgery or the plaster for him is a must. We cannot say that homeopathy medicine will cure him completely with broken hand or broken bone It can be, but if there is a bones are not getting healed properly, he can get a adverse effect of it. So surgical diseases where surgery is required, there are few examples that I explain you. In the dynamic diseases, this is our part. This for homeopath, this is the most important thing, because dynamic diseases will lead to the another process to the final outcome is the disease. So first of all, your vital force get deranged, and that takes place, and which progresses with disagreeable sensation, with abnormal function in the organism, and it leads to, or the final outcome is the disease. So in dynamic diseases, there are two. One is acute disease, one is chronic disease. What we are looking today, or what we are going to study today, is acute disease. Acute disease is individual disease, a sporadic disease, and epidemic disease. As well, chronic disease. Chronic diseases are like disease with fully developed symptoms and diseases with few symptoms. So disease with fully developed symptoms will have non-miasmatic background or the miasmatic background, because on a miasmatic way, the disease will grow according to the miasm or the prominent miasm or chronic of the patient. So in the miasmatic way, there are single miasm involved, or maybe of more than two miasms involved in the disease. Like we have studied in Organon of Medicine, aphorism number 40, the complex disease. So Sora, psychosis, syphilis. Sora is the mother of all psoric disease, all the diseases, and were built up of psychosis and syphilis. So sometimes you will find Sora psychosis, the complications in some patients, or sometimes Sora syphilis or psychosyphilis, and or sometimes even all three miasms are mixed together. So this is little bit brush up about the basics of our knowledge about the diseases. Now in aphorism number 72, what Dr. Hahnemann has said, the rapid morbid process of the abnormally deranged vital force, which have a tendency to finish their course more or less quickly, but always in a moderate time. And these are termed acute disease. And I know, uh, I can tell you, in the college days, this was the on my tongue, the definition of acute disease. Someone, if any professor or any teacher asks, tell me about the acute disease, we used to quote as it is. It was a tip of tongue. Rapid morbid process of the abnormally deranged vital force, which have a tendency to finish their course more or less quickly, but always in a moderate time. So this is about the acute disease. I will hope I will again tell you in a very short acute disease, aphorisms, and the classification of disease, and where we learn about acute disease, individual disease, sporadic, and epidemic. Right now, dengue fever or chikungunya fever is a sporadic disease, or in some areas it is an epidemic disease, and not a long, but very in the past we have seen the pandemic disease of COVID-19, and we all know the effect of COVID-19, or the what was the scenario that time, and how people were very fear, scattered, and it was a sudden onset. Suddenly it was spreading everywhere, and lot of people got affected. Lot of people in the mass it got affected. So that's how the pandemic disease. It's again a part of acute disease only, because it was either a recovery or a death, and that we have seen very closely. I'm sure you must have also seen in either in your patients or in your relatives, in your family members, and I must say we cannot forget it for next 20 years at least. What we have experienced in the pandemic of COVID-19. Aphorism 72. We were here. So, dear friends, if you really want to treat the acute diseases, first make your mindset to learn and finding the very important characteristic, single, peculiar prominent symptoms in the patient, and that you cannot do without observing the patient. The observing patient is very, very important. So observation, and to not make it monotonous, I would like to you interact with me. Where is the chat box? Yeah. I hope you are able to see the screen. If you want, I can maximize it. Is it okay? Yeah. So observation is the most important key for the successful prescription. Now, dear friends, from you all people who are attending live, we will do a kind of quiz, or you can say interactive say interactions. Make it a full screen, okay? Yeah. So in Kane's repertory, there is a rubric: mind smiling involuntarily. So you will find how you will find this rubric in patient. Like patient is telling you some symptoms, and then he will smile involuntarily without any reason, but he will smile. You must have find in your practice. There are many patients who comes, you sit there, and while expressing the symptoms, they will smile involuntarily without any reason. They are smiling, and they are smiling when you are talking. Also, they are smiling. So it's very, very important symptom. And the remedies, if anybody can tell me, there are 3 remedies mentioned in Kent repertory. I think 2 remedies only, not 3. In newer repertories, there are many, but in Kent, there are only 2 remedies. One is belladonna, and second is aurum metallicum. So you will find in these 2 patients, and you have to observe it very, very, very carefully. The patient will smile while talking, involuntary. Okay. There is another symptom. See, dear doctors, today we are learning about acute cases. So this way you have to sometimes you don't have a time to take the whole history, and you cannot explain every patient to tell in much detail. He will tell the mind symptoms, he will tell the physical symptom, he will tell the cravings, thermals, everything. What is prominent in the patient, you have to observe it. So Patak repertory, patient coughing, 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 and he's putting hands on thighs, and that gives relief to him. And there is only remedy mentioned in Patak, but you can open the Boric Mater Medica, Patak. I don't think Alan has given. So can anyone tell me the remedy? You will find, or maybe you start finding it. A patient comes to you and you observe him, how he is coughing. Is it paroxysmal cough? Is it a deep cough? Is it a dry cough? Or he's better with expectoration? The cough is a barking cough. You have to observe it, doctor. And what he is doing while coughing. Many times I have seen patient coughs, 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 and then better with drinking little bit of cold water or warm water. I have seen in few children's, not seen, but the parents narrate it. Doctor, our child, he is sleeping in the night, and then suddenly starts coughing, and he cough, 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 a lot of cough, and then he's finally vomit it out, the food what he had, and after that he goes to the sleep. So this is the question to you. You can answer it now, you can answer it later. So I will repeat again. The child is sleeping in the night, and suddenly he started coughing, coughing continuously, dry cough, coughing, 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 and ends in the vomiting. And after vomiting, he feels better and he goes to the sleep again. Okay. So Nicolum is the right answer. Dr. Rachna has given. Nicolum, very specific. In whole mathematics, we will find only remedy that feels better by putting hands on thighs while coughing. cough lying on knees with head on pillow ameliorate. Can you imagine this symptom is patient telling you? Very difficult. But you have to ask the patient what position you feel better while coughing. At what position you feel better while coughing, or in what position you feel better. So the patient has to lie down, put his head on knees, put his head on pillow, and he has to be on knees. And that position gives the relief in the cough. The only remedy in Kent is Eupatorium perfoliatum. Another one, cough violent spasmodic jerking of the head to forward. The patient will cough like so his head will go forward and the knees comes upward. A very interesting remedy is Theridion. Okay. Miasmatic background. So in the miasmatic background, you will find in every case we have to look for the miasmatic background. Like in acute miasm, we have remedies like actonite, belladonna, nux vomica, veratramal, stramonium arnica, etc., etc. And in the chronic miasm, sora, antisoric, antipsychotic, antisyphilis, antitubercular remedies. Potency selection is a very, very big topic. On way to repeat the medicine or repetition of the medicine. So common acute conditions that we see in our practice is fever, cough, upper respiratory tract infection, throat infection, acute otitis media, headache, colics or colitis and diarrhea. I know you must be seeing lot of patients from this kind of acute conditions. And the secret that I will tell you or I will share with you, in your practice, if you really want to grow or you grow your practice, you have to handle acute cases. Unless you handle the acute cases, patient will not get faith in you. The doctor should be able to handle acute cases very confidently. See, for you, you can say that I am a homeopath. In acute cases, might be there are sometimes there is scope of homeopathy, or sometimes as a beginner you are not able to understand the case or not able to treat it in acute phase. But you have to learn it, and treating acute case is our bread and butter for us. So, dear friends, dear doctors, dear colleagues, please, please make sure you start reading, learning, or and as well as handling acute cases in your practice. No matter we will fail. Even I also failed so many times. But what we learn from the our failures is that we will find the new ways to understand it or to improve our mistakes. Case taking and analysis. In every case taking, we have to understand with the chief complaint. In acute cases specifically, patient remember elements from. So you have to understand the what is the cause of the patient, or what is the cause behind this disease. Because cold and cough after having ice cream, after having a cold water, and then modalities, what makes it better, what makes it aggravation, amelioration, what time it gets aggravation, the temperature, cold better, warm better, and the craving and aversion during the acute condition is very, very important. Physical general like thermals, patient is hot or chilly, is very important. Without it, we cannot differentiate any remedy. Thirst, very important. In fever cases, if you really want to treat fever, you have to understand thirst is very, very important and differentiating one to differentiate from one remedy to another. Then the appearance of tongue is very important. By just looking at tongue, you can tell the remedy in fever cases. It's very, very important. Craving and aversion, sleep position, appetite, perspiration, covering he needs fanning or bathing with cold water, warm water. It's very, very important. Past history, family history, change in mental state, dreams, energy pattern, irritable, crisis, exciting factor, anxiety, bad news, failure, disappointment. This is again important. So I will start with the case because I found many people they are just waiting for the oh, how we can minimize it. Yeah, I will just go back again. Yeah. If you have any doubts, you can ask me in the chat box. I'm happy to answer your questions. So we'll start with the cases. I will show you some cases of fever, some cases of other conditions, acute conditions. Music 11. So this is a case that really opened my eyes, or I was able to understand how homeopathy has a vast scope in treating acute cases. So this case has opened my eyes, or you can say this was the opening case. After that, I had a confidence to treat a lot of acute cases. So this is the case of 36-year-old male patient, and I can tell you that time I was in Mumbai Homeopathic Hospital. I was a house physician, and I was called at night 2 a.m. to see the patient because patient had come to the hospital in acute condition. The patient was a case of bronchial asthma and taking treatment, and suddenly he developed this episode of acute abdomen. And in a panic state, the family members took the patient to hospital. But I think they were not aware is it a homeopathy hospital or allopathic hospital. That's why. Otherwise, I see nowadays the patient when they get the panic or the acute attacks, they rush to the allopathic hospital most of the time. But this patient had come to the homeopathic hospital, and I was called in the night to see the patient. When I came to see the patient was lying on the floor, and patient was not in a state to tell me any symptom. Okay, so someone was in chat some message, so I was reading that. So patient was lying on the floor, and he was not in a state to tell any symptom, and that's the where your observation and examination of the or the clinical findings is really important to deal with such cases. So this was acute abdominal pain, very severe. Patient was lying on the floor and he was literally in a very bad phase. And the 2, 3 relatives along with him has come, and they were looking at me what this doctor is going to do now. We have got the patient for you, and what you do now. They were just observing me, and I was observing to the patient. And in that scenario, in my mind, lot of things were going. Is it the case of cholecystitis? There is a acute episode of cholecystitis, and the patient is had it, or is it a renal stone, or is it a gastric ulcer, or is it appendicitis, or any other you can say the disease condition. And you can see here lot of disease condition, even acute pancreatic attacks. So all has acute abdomen. In the big title is acute abdomen, but there are so many clinical conditions that you have to identify, you have to clarify. And nowadays we have new techniques like MRI, CT scan, sonography, and with that, along with blood test, we can easily find out, or we can easily diagnose the case. So the patient was not in a state to do any of this MRI or CT scan or sonography. And he was observing and doing a examining him. And what I found, without any symptom, I just found that the patient was lying down and cold perspiration. When I checked, the patient's skin was very cold, clammy, and he was profusely perspiring. And he was crying. He was crying with severe pain, and he was asking for the help. No modalities I was able to find out, but except I found that the patient was lying down and his shirt was up, his abdomen was completely uncovered. And that's what it struck to me, that this is the one way that patient is feeling better, to uncovering the abdomen. Now, lot of remedies were in my mind, and I started thinking what remedies it can be. Very heavy, profuse perspiration, coldness of the skin, cold, clammy skin, profuse perspiration, acute abdominal pain, and uncovering of the abdomen ameliorates. These four symptoms were the totality of four symptoms in my mind, and I was thinking about which remedy it can be. And then someone has a in chat box said tobacco. Might be. So I was not sure which remedy he is, or that time which remedy can help this patient. Because if you say Patak, if you use the Patak repertory, generally I use Patak for acute cases. So abdomen uncovering ameliorate and sweat cold. You find tabacum, Sikale core, and Pampora. Now, what was the other feature or other symptom that can be a sure shot prescription? So, patient had a episode of vomiting. You will I will just go back. And I was wondering, vomiting is one symptom that is I should find out to differentiate it. And then Dr. Sadia is very rightly said tobacco was the remedy, because vomiting with cold sweat and the skin cold. And if any of you know, if by mistake you had a tobacco, you first get the giddiness and the vomiting sensation. So vomiting is very prominent in tobacco compared to other two remedies, camphora and Sikale. So with tobacco, now I told you in beginning, the main problem is not the selection of remedy for a homeopath. The, in every seminar or in every webinars I have seen, everyone asks after the selection of remedy the doses and the potency. So what potency here? So 1M I choose because it was very prominent. Symptoms were very clear, characteristics single, peculiar. And what I have learned from my practice now 10 to 12, 14 years, and earlier also, higher potencies are much more acts better in acute cases. If symptom corresponds, if I get a very characteristics, peculiar symptoms, I choose higher potency. If not much peculiar symptoms, and I'm giving just on pathology or physiology or the general symptoms, then I choose lower potency. So in this case, tobacco 1M, one dose stack, then wait and watch. I ask the patient to be there in observation room and we have to observe it. What happens after 1 hour? What happens after 2 hours? What happens after 3 hours of giving the medicine? And then every hourly we have prescribed him one dose. Every hourly 3 more doses, and then patient was much better after first dose. I waited. I could repeat second dose. I repeated third dose also. And then I asked the patient after 3 4 hours that now you feel better, so you can go down, go to the home. But I will tell you what was inside me, what thoughts was going inside me. I was very happy after 2 doses because patients was started getting improved, started getting better. His abdominal pain was almost 50% better after first or second dose. So I asked the patient to leave the hospital and wait and watch and report me every second day, third day, or maybe every alternate day. You can either call and report me. And next day in OPD, patient again come and reported, and he said no pain after that, no episode of vomiting, and much better overall. No perspiration also. His appetite also improved. So this was the case that has that I learned so many things, that how homeopathy is important, or how homeopathy can be helpful in acute cases. So this is the after 15 days, again patient was much better, no episode even after 15 days, 20 days, and he continued his medication for bronchial asthma after that. Now, fever. Fever, everybody gets fever when you get the fever cases most of the time. So, dear doctor, Dr. Hippocrates is the father of medicine, and he himself says, give me a fever and I can cure my any disease. So, dear doctor, the only message I wanted to convey you treat fever with confidence, and you please make aware patients about the fever, because lot of patients has a misunderstanding about fever. They feel fever is some enemy for them. So this is again 40 years old patient was admitted to the IPD. He has very high fever and he was admitted to the hospital. And we after that we did a routine test, and he was dengue positive fever. He was diagnosed with dengue positive fever. So very high fever followed by chill, and there was no fixed pattern for him. And then extreme weakness, and he was on a complete bed rest. So after 4 days, means on 2 days fever, he was at home. Third day he was admitted to the hospital, and then on fourth day he developed the rashes on his hand and on the back and on thighs, and definitely we know the dengue fever comes with rashes. And we did a blood test also, and his first CBC report 1.2 lakhs approximately the platelets, and then it dropped to 80,000, then 40,000 in subsequently. We used to do blood tests in morning and evening, morning and evening. And on fourth day we night, the report came with 15,000, and we were very not in panicky, but we were very concerned about this patient now, because the patient has 15,000 platelets, and anything can happen, and we have to rush it. If any emergency can happen, then we have to give it in the factor platelets. But somehow patient was doing better. Fever spike was there, but still he was doing better. He was feeling better. So we said we'll wait and watch. So then he get very heaviness and headache, better with deep pressure. So patient as a person, he was staying alone in Mumbai. He was from North India, and he was here for some work only. Without his family was not here. So he was missing his family, and as his nature, he expressed his nature like he don't like to fight anyone. He's never argue, and he's never hurts anyone, and he don't get any involved in anything, any jhamela. And in his words, money anxiety, definitely he wanted to earn money to fulfill his family's needs. So patient was really worried about his health as well as his family. And after seeing the reports, we were also worried for him. So fear of local train, fear of dark, and since he was admitted here, he has a fear about health, what will happen, and he heard about that dengue fever is very fatal and anything can happen. And this fearful about this situation wanted to go home after recovery. So this was the scenario, and the patient was in a state of little anxiety, little anxiousness for him. And we had started him with, I believe, with belladonna, with other symptoms. We started with belladonna for first day and second day, and there was much improvement with him. And then his general appetite was reduced. And, and thirst was very thirsty, but desire for cold water and sprint sometimes. The only point we found it, because every day we used to re-evaluate the case with any new symptoms if we get. And on fourth day, mostly third day evening or fourth day, he told us, I was the hospital, so I was taking the case every night and morning. We used to take a new totality if any new remedy can come. And the key point I found that everything tastes bitter except water. He told me everything I feel is कड़वा लगता है, कुछ भी खाया कड़वा लगता है डॉक्टर, पानी पिया तो थोड़ा ठीक है, पानी मुझे अच्छा लग रहा है, मैं पानी बहुत पी रहा हूँ, ठंडा पानी मुझे अच्छा लग रहा है पीने. So we stopped belladonna after that and we started with the aconite. So aconite is the one remedy where you will find in Kent repertory everything tastes bitter except water. Another remedy is Stannum metallica. After aconite 30, one dose we wait and watch for any fever spike or episode, but there was no fever for next 3-4 hours. So we repeated again 4 doses every 4 hourly. So most probably this after 5 day or 6 day, the patient started improving. There was no fever, rashes disappeared, platelet started improving, and I believe after fifth or sixth day, the platelet was above 1 lakh and patient was in much better condition. So we discharged the patient, and this way the patient got better only with homeopathy, without any saline, without any Wenger lactose RL, or without any allopathic medicine. And I've seen many patients who takes the allopathic medicine during dengue or malaria. They are suffering with lot of weakness after the medication. So this way, as I found, homeopathy can help patient to improve the patient in much better way and in a very in a rapid and very safe and easiest way to improve the patient. And here you will find Kent's repertory mouth tastes bitter, everything except water. And now you can ask me, you may have doubt that on one symptom you have prescribed, but if you go and understand his mind state, he was very anxious about family member, very anxious, so very anxiety, lot of anxiety. And aconite is the known remedy for lot of anxiety. Fever comes suddenly, redness, congestion, rashes. So if you read the aconite first page, second page, and you will be able to understand how the mindset of aconite is. So this is the one everybody has a question about it. Then the most difficult thing in our practice is when to repeat the dose. So you may find that generally if a patient gets better, or in acute cases if he gets a slight aggravation, then we will don't repeat the dose or will not think of giving another dose, even change of medicine. If patient gets slight aggravation in acute cases, that is the time that we have to stop the doses and we have to then wait and watch. Wait and watch is the key in every acute cases. Don't be in hurry to change the remedy frequently. Give the time the body to react to the those what medicine or remedy you have given. So there are some conditions where there is necessary to repeat the dose, and for this there is no clear cut rule. You will not find any clear cut rule in any book in homeopathy when to repeat and how to repeat. It all comes with your clinical practice or experience to handle the acute cases. So this is very, very important. You start treating acute cases and you will understand in every case you need a different approach, or you need to think differently when to repeat and how to repeat and when to stop the medicine. It's really, really a challenging, but you will get it with experience. There is no book has written about it. So case of acute fever, I think we will go fast little bit. This is a 5-year-old girl came to the clinic, and she had the history of exposed to the rain. She got wet in the rain, and after that, next day she got the fever. The parents came and they bring the child, and they said, "This is the condition. Child is getting very irritable and not talking much, little bit very weak and this, and she's getting very chilliness during fever. And along with fever, she get the urticaria rash also, urticaria rash on extremities, on back during fever. So whenever patient come to you, you first thing you have to observe how the patient come, how he sits, the posture of the patient, and what he do in front of you. It's very, very important. Then the clinical examination is the must for every cases. At least not every cases you should do in acute cases. You should start taking the pulse, taking the blood pressure if necessary, examine the patient perspirations, the other rashes on skin and everything. So fever was 101, and definitely you must know if fever is 100, the pulse rate should be 100. And after 100 degree Fahrenheit, if fever gets higher with 1 degree, the pulse rate should correspond 10. So raise in 1 degree of Fahrenheit will correspond to the increase of 10 pulse rate. So for 101, pulse rate should be 110. For 102, pulse rate should be 120. So tongue was very coated and red tip of the tongue. Extremities very warm to touch. Eyes red, congested. And what I observed, patient was sitting there and he was constantly shaking the legs continuously. The mother was telling the patient, narrating the patient's symptoms, and patient was completely shaking the legs. With this analysis, how will you analyze this case now? So we have the physical general, the patient has fever, the concomitant is restlessness of the legs, and the observation or the clinical finding is red tip of the tongue and elements from damp weather. If we take all this totality together, you will get fever chill with uh, arterial rashes during fever and restlessness of the legs, and these all three together leads to rust tox. And if we take about the tongue, tip of tongue red and a damp cold weather aggravates another, again the rust tox comes. So doses, rust tox 1 m because very prominent, very acute characteristic symptoms. So I started with rust tox, 1 dose, wait and watch. And after giving a dose, generally I ask the patient, if patient come with fever, to wait in the waiting room for 30 minutes to 1 hour if needed. So generally after 30 minutes, I'd go and reevaluate if patient is better or not better, his fever is again same or it's declining. So this you have to do it, because just giving a symptom, a remedy and ask the patient to leave the clinic, sometimes remedy works, sometimes it doesn't work. So always better to ask the patient to wait for 30 minutes if it has come to you with acute fever, because that will give you opportunity to again understand it or see the reaction of the remedy. And what I saw after 20-30 minutes, the patient was went to sleep in mother's lap. And I was very happy to see that, because I knew by this time the medicine started working. Patient is better. He, he went to sleep. Then I given the SOS also and asked the patient to report me again after 3 days, 4 days, 5 days, whenever on phone call. So no episode of fever after the dose. Patient was very active and playful and doing better. Even skin complaint also got better. So 1 minute. So benefits of fever. That's what I wanted to tell you. The benefits of fever. Please, dear colleagues, dear friends, dear doctors, please understand. You can take a screenshot of these PPTs if you want. I will not be in a hurry to change the PPT, but make aware about it. The fever, how fever is beneficial to our body. Restrictions to reproduction of pathogens. If you get a fever, see how fever comes. You get the infection, then the viruses and bacteria secrete the endotoxins. Then endotoxins spread it, and then your immune system get activated, and the immune system gives the message to the hypothalamus that the infection started or the inflammation has started in the body. And what hypothalamus does, it started, it is the it controls the temperature of the body, so it started increasing the temperature of body. And what happens after increasing the temperature of body, the bacteria and viruses all get restriction of their productions, because most of the bacteria and viruses either they survive in the lower temperature, or either they can survive to the very high temperature. So if your body started increasing the temperature, the bacterial growth, the virus growth, they gets restricted and they cannot survive at that temperature. And that's how there is a sudden drop in the reproduction of pathogens. If fever goes from 99 to 100 to 101, 102, though you will find little discomfort or uncomfort, but your body's immune system is acting at that time. And please don't bring the temperature to normal during this process. Otherwise, what happens? The bacteria and viruses growth increases again. When you take a crocin tablet and temperature comes down, the bacteria and viruses are free to now reproduce, or the production increases. And the fever, which should be there for 2 days, 3 days of time, it gets extended to 5 days, 7 days, 8 days of time. So if you take a crocin for a small rise in temperature like 99 or 100, I must say that your fever or your immunity is getting in a bad shape. So your immune system creates a defense mechanism against any certain infection, and then the taking of crocin or any paracetamol bring down the temperature back to the normal, and then our body cannot give the defense to this external infection. So this is the first reason that you should not bring your fever immediately down to normal temperature. If it is coming, it's a good sign. You should be very happy that you are getting a fever and your body gets heal easily and naturally. Now it decreases the time of infection that I explained you. Third reason, you should not bring down the fever immediately down, because your WBCs gets activated, your neutrophils, monocytes, eosinophils gets activated and recruits the soldier to fight the enemy. And if this process is going on and you take the crocin again, your body's immunity gets down, or it cannot develop. And the phagocytosis is the process where a body or the immune cells have the ability to eat the viruses and bacteria. It just, the spikes comes and attach on the viruses or the endotoxins, and the phagocytosis process starts happening, and it eats the bacteria or viruses. And that's how your body naturally can, the body's natural ability to overcome the infection. And if this process is already present in our body, better we should wait for the fever instead of taking a antibiotic and the antibiotics. Decreases in endotoxin effect. So endotoxins are released by viruses and bacteria, and the decrease of endotoxins and the pathogens will die and releases endotoxin and creates all sorts of negative effects. And fever can minimize that effect. So endotoxin effect can also be minimized if our body's fever last for 1 to 3 hours. So it give time the fever give time to the body to overcome the infection. Increase the growth of T cells. T cells are the killer cells. This will be activated with the infection, and our body's immunity will activate the T cells and or killer cells, and they will identify the bacteria or viruses or the foreign bodies, and they will attack on it and they will kill it. So you will be surprised to know during fever also, whatever the toxicity in our body, maybe some different cancer cells or maybe some different, you can say, all kind of cells are there in our body, but they are not active, they are just bit dormant. But when our body gets infection, our immunity gets activated and it can attack on that other cells also, and our body gets free from this kind of toxicity or toxic cells. So please give your body opportunity with the fever to overcome the infection, because it will naturally, if our body immunities get activated, it will not only overcome the infection of bacteria and viruses, but it will overcome the other bad toxic materials or toxic cells in our body will also be eaten by the our phagocyte, either by phagocytosis or by killer cells or T cells. So decrease in mortality rate, this is the one I'm very sure that you must have also seen during the pandemic phase. Those patients took lot of medicines, had higher chances of mortality rate or the higher chances of getting affected or side effects of by the medications. So what time is it now? It's 11:30. Dr. Yamini, should we continue again, or we should stop here? Dr. Yamini, should we continue or we should stop here because it's 11:30 now?
We can continue, Dr. Shrikant.
Okay, okay, yeah. So I hope you able to understand the cases, because I have seen 1 or 2 cases mostly. And the important thing that I wanted to make aware to all the doctors and homeopaths and all the local, all the peoples around us or the family members, how important is the fever for our body, for the betterment of our immunity. Okay. Now, not only fever, not only acute abdomen, but we get even renal stone, the asthma complaint patients, they all come with the acute disease. So I will just share another case of long-standing diarrhea. So what is this case very affected to me very deeply, because the patient was suffering for diarrhea since last 7 years. Can you imagine someone is suffering for a loose motion or diarrhea on and off, though it is on and off, but suffering for so long, 7 years? What must be the condition of that patient? If someone gets a loose motion for 5 days or 7 days, he gets completely, uh, we can say, complete prostration, and he has to be at one place. But this patient, a 38-year-old female patient, and she got this loose motion problem or the diarrhea since last 7 years. It was on and off. And what symptoms she told me, that she gets a cramps in abdomen and she has to walk with completely bending down. She cannot walk straight most of the time. If she's sitting for a long time and then she has to get up and walk, then she has to walk with bending down because her back is very, very, extreme pain with stiffness, nausea, weakness, tiredness, knee pain and body pain since long, aggravation after the periodic episode of loose motion, fever recurrent every 1.5 hour to 2 months, every 1.5 to 2 months interval, loose motion, watery, offensive, painless. Patient is now habitual to it, and the patient told me that now I am habitual, that the loose motion comes and go, comes and go. I don't take any medication also. And then the numbness of arms if carrying any heavy objects. I get tired feeling if I walk for at least 10 to 15 minutes or so. Complete prostration and weakness due to loss of vital fluid. Even weight loss also had happened to patient, 10 to 15 kgs loss. So since 2 years, body pain, 7 to 8 years, loose motion, sciatica pain since 2 years, aggravated with exertion, walking for long distances, low back pain, and loss of appetite. She says that I don't feel hungry. I don't feel to eat anything. I just eat because I have to eat with my family members, the lunch and dinner. Otherwise, I don't feel much hunger. So the elements from how it started. Always ask onset, duration, and progress for every acute cases. How it started and what is the duration, how it progresses. So started after the second delivery 7 years before, and then he started with involuntary diarrhea stool. Fever was intermittent. Whenever fever comes, it comes in the night or in the evening time, specifically at 6 p.m. Fever with chills. The patient gets fever along with chills also. And the recurrent urinary tract infection with cystitis. Slightest exertion aggravate the complaints. Sweating on back, on face, on upper body. I am very positive and practical in my life that things will get better. Though right now I am in a bad phase of my health, but I have to overcome this situation. The patient was in a very suffering from lot of complaint, not only the loose motion, but she had the recurrent urinary tract infection, recurrent fever, cystitis, back pain, body pain. But she was very, very hopeful that she will get better. Now, how to analyze this case? The patient is suffering from loose motion from long standing 7 years. It's on and off. So first thing that we have to understand the periodicity of the complaint. Patient gets periodic fever every 1.5 to 2 months. Loose motion recurrent periodically. So periodicity is one. Then elements from of the vital loss of vital fluid. Then the third one you have to take that mentally patient is very positive, but inside what is her inside feeling is that she's stuck somewhere. She cannot overcome the problem. The situation has come that she has started not accepting, but she's like, I'm suffering from this, I have to overcome it, but the time has not come, or might be my body is not overcoming it because right now I am in a very bad phase. So if you understand the patient mind state, see in every cases you must have seen. I have not given a much more importance to mind symptom, but it is not true. In every cases, the mind symptom plays a very important role. Though it is a acute case or chronic case or any, in homeopathic case taking, mind symptoms are always at the top. But it is not necessary every time patient will come and tell you the mind symptom. Sometimes you have to understand it with the patient's attitude, the way patient is narrating the case symptom. She will not come and directly tell you that, doctor, I am in a very deep emotional trauma. She will not come. You have to find it out. You have to understand the patient's mind state every time. So I took the rubrics directly from Phatak repertory: diarrhea, eating aggravates, diarrhea, painless, diarrhea as a complete rubric. Then the periodically it gets aggravated. Then the Phatak repertory: diarrhea, chronic, and intermittent fever, regular at same period every day. The first remedy came China, second is arsenicum. So what do you think? Should we give China ars? Because this is the combination again. We may think about it, but I have not thought that way. I was very sure and I was very clear about the remedy because the mind state was like she's stuck somewhere and she has to overcome it. How will you interpret this in the mind state or in the our rubric form or the delusion way? I will say delusion. Fever evening 6 p.m. China is the remedy which comes very prominently, and I have seen lot of cases specifically coming periodical cases, though the malarial tests are negative, dengue tests are negative, but the patient is getting recurrent fever specifically in the evening or in the night time, and some sometimes the patients comes with a very after taking lot of medication, antibiotic or anti-malarial medications and all, and still not improved. So in homeopathy, lot of cases has come after trying different allopathic approaches, and that's the way we have to treat cases or patients and give them confidence by giving results. So dear doctors, in homeopathy, if you can give results, you are the boss, because result oriented practice is one where you get lot of patients through references. You don't have to advertise every time. You will get patients if you do your homework properly or basic things. Your practice will flourish in very short time, and the mind delusion work is hindered at. She's not getting, she's stuck, she's not getting overcome. So in our repertory, the symptom is in a way it is mentioned that delusion is hindered at work and mind weary of life. She's complete weary. इसको बोलते हैं ना नैराश्य, frustration complete, थक गई सब चीज, weary of life. If you take these two symptoms, again you will find China. And I prescribed her China 30 TDS for 2 days. Now again you will ask me why TDS, why BD, or why 30 only and then 200 1M 10M. So I will tell you, this all comes with the experience. I have seen in few cases repetition is required and then long wait and watch for 10 days, 15 days. In some cases, giving 1 2 dose and then wait and watch for another 4 hours, 5 hours, or 1 day. So this is again a case to case. This was a long standing case. That's why I was in a thought process that I should give a repetition, ascending potency, and then wait and watch for another 15 days to 1 month. So China 30 TDS for 2 days, China 200 for 2 days, next 2 days. So first 2 days, next 2 days, next 2 days, and 2 days. So total 8 days medications, 30, 200, 1M, 10M. Frequent doses followed by wait and watch for the reaction of the medicine. So I get after 15 days, patients follow up that she was really feeling better. Relief for the loss of lose motion, sorry, not loss, lose motion. Thought, though I am getting a few episodes, but less than what I used to get. Appetite little bit improved. She feels hungry. Sleep is better. Thirst is improved. Positive. Her mind state like again more positive thoughts for recovery, for getting more energetic. Now she's able to walk in a much better way, not feeling much tired that she used to get tired after walking for 10 minutes, 15 minutes. And she's very happy with the medicine. Still medicine is going on. I have not repeated after that also because patient is improving. So in some cases, you get results in 5 days, you get results in 1 hour, you sometimes you get result in one day, and sometimes you have to wait and watch for maybe months. So this way we have to understand the patient's pathology, patient's response to the medicine, and with your experience you will understand it. There, there. So detox channel, as I told you about fever also, that fever is again a detoxify our body. So this way, sometimes you get a diarrhea for 1 2 days, your body get detox. You get lot of sweat after fever or after exertion or gym or after running, your body get detox. Or so this way you have to detox your body, allow your body to detoxify. Now the diseases, as I told you about the acute disease, now you can understand the first stage of disease that generally we treat as acute disease is the first stage of disease. Cold, cough, diarrhea, inflammation, fever, vomiting. But if we are not able to treat it properly and if we suppress the cold or suppress the fever, suppress the inflammation, most of the time, over the period of time, maybe months or maybe after years, we will find out that the patient is getting blood pressure without any reason. Patient is getting diabetes because nowadays, if you see with open eyes around you, you will find so many patients with diabetes, so many patients with blood pressure, so many patients with thyroid. So this has not developed over a night. This has developed over the years because our mindset, our brain get washed, our brainwashed that fever is not good, or the if you get fever, you should take crocin and get better. Allow your body to heal yourself. Otherwise, you will develop with the complicated diseases like thyroid, like chronic constipation, like migraine, sinusitis, bronchitis, varicose veins, gallstones. Suddenly, the gallstone cases have increased a lot. The reason don't know, and the treatment is only surgery. If you meet surgeon, he will suggest surgery. But if you meet a homeopath, he will give a medicine, and might most of the time you will be free from the gallstones with 3 months, 6 months, 9 months of treatment. I have I have a lot of good experience with gallstone and kidney stone, and our surgery was completely avoided. Hypertension, osteoporosis, backache, menstrual disorders. All these complaints that we are looking today as a chronic problem or as a chronic disease, somewhere the root cause is in the first stage of disease or the acute cases. That's why we have to understand and the importance of treating acute cases very properly. I'm not opposing to don't give crocin or don't give, but allow your body to heal you. If it is not getting better, then you can intervene with homeopathic medicine, Ayurvedic medicine, or allopathic medicine. But allow first itself. And if you are still in a second stage and doing a same mistake, then you will land up in the final stage where you get heart attack, cancer, AIDS, stroke. So these are the few symptoms or few diseases that just name. But this is the cycle, or not cycle, but this is the steps that the disease gets developed and with the understanding of miasms. Sora, then psychosis, and then syphilis. So I hope this is the enough for today. I'm sure you must have got different way that not only the cases and remedy, but I was very happy to share the fever and the importance of fever and how we should treat it. So hope you will also educate the people or aware the people about importance of fever and acute diseases in our life. It is required. Yeah. Okay, any questions anybody has, I will be happy to answer.
If you have any questions, just you can just open your mic and talk to Dr. Shrikant directly, or you can write down in the chat box.
Any book you can suggest for acute diseases in initial practice? Yeah, there are so many. Uh, One is you can start first with the Dr. Gajanan's book on fever. Then there is another book by Allen, that is the Therapeutics of Intermittent Fever, where he has explained more than 40 remedies and differentiated it with other remedies along with repertory. Then if you talk about today's generation, so Dr. Gaurang has also written a very good book on acute diseases. His book on I think the maps, homeopathic strategy and maps on acute conditions. So this is also a very good book where he has also given a cases and the repertory analysis. Dr. Gajanan, I have in my initial days and during the courses at other song, I have seen his cases and attended his OPDs, that how effectively he handled the acute cases and very result oriented practice. He enjoys the treating acute cases, and from there I got the inspiration. When Dr. Sarkar, you will not believe, in his clinic where he practices, not only the patients comes and visit to his clinic, but sometimes ambulance do comes, and patient is in ambulance, and patient has come from the ICU or from the hospital. They took the discharge and come to Dr. Sarkar to get the homeopathic treatment, and most of the time gets better. Yeah. So that really inspired me when I was at Kolkata, that how effectively these challenging acute cases or ICU cases, how effectively Dr. Sarkar is treating and is getting very good results. But I believe me, he has a practice, is a different practice, and he has a experience of treating such difficult and challenging cases that he even can't imagine. So that only he can do. But we also can learn. We can learn from our practice, our mistakes, from some stalwarts, from some books, and we can grow in homeopathy. So, Dr. Rachna, I hope I answered your query.
Sir, I have a question.
Yes.
So, in certain cases, we encounter that the patient does not, that the fever does not reach the normal temperature. The patients, the in pediatric cases, the parents often tell us, okay, it was 100, now it's come to 99, now it's 99.4. And then we are often like, in aphorisms में तो लिखा है, temperature drop हो जाएगा, normal आ जाएगा तभी दो, because during the paroxysm, the vital force is in activity, so you cannot give the medicine. So, how do we manage such cases? And such anxiety of the parents as well.
When you are treating a pediatric patients or pediatric cases, first you have to manage. First, you have to make parents understand what you are treating and the pattern of the fever. So parents gets very panicky and very anxious if the child gets 99 degree Fahrenheit temperature. So you understand then that fever is very good sign. It has come, so it will improve the immunity. You let the fever come to 101, 102, there is no problem. If it goes above 102, definitely then we have to intervene with the paracetamol, crocin, or any medication. And in the homeopathic part, if you are asking me, so for in my experience, most of the time homeopathy works very effectively and no need of paracetamol or crocin. But in few cases, if it is not in a control and it goes above 102, I ask them to use the paracetamol, because there is parents, if they gets above 102, and most of the time in pediatric in patients below 5 years, 3 years to 5 years, if the temperature goes above 102, 103, the patient can get convulsions anytime. So up to 101, 102 is a very safe. You can educate the parents. And but now homeopathic way, how you will give homeopathic medicine. So best way, you take the information from parents and observe yourself. How child is behaving, what he is doing, before the fever how he was, and now how he is doing. So this is very important. And then you have to examine it, the pulse rate, the the fever, is there any partial heat on the of the body, or the tongue, how is the thirst, how is the appetite. It will guide you the patient is improving or the SQ status quo of the case. But most of the time you will get a good totality, and homeopathy works really well in pediatric cases. This is my experience.
But sir, is it recommendable that if suppose the fever paroxysm does not come to the normal temperature, we can introduce a homeopathic medicines even when it's 99.4?
Generally, we should not. Generally, we should not. It should come back to normal. But if you are giving a medication, you can ask the parents to, instead of giving one dose, you can dilute the medicine. You can give the diluted doses. So you can ask them to uh, add 10 pills in a half cup of water and give 1 teaspoon now, 1 teaspoon after 15 minutes, and 1 teaspoon again after 15 minutes, and then wait and watch.
Okay, thank you, sir.
Yeah. Okay. Welcome. So frequent doses sometimes required. So this way you can give the diluted doses. Okay. Dr. Eldridge, how are you? After a long time, I am hearing from you. Okay. Any other questions? Good. You asked the question about this, because this is uh, this part is very, very important in practice, that patients, the parents get very panicky and anxious when the child gets fever.
True.
Okay. Yeah. Anyone has question?
I can't see any question, but if you have any, please write down in the chat box or you can just speak up.
Yeah.
And this is very valid question which Dr. Sadia asked. As it happens very many times that recently I had one such episode where parents just told me that they called me almost like 6-7 times in a day and said, "Ma'am, बहुत fever hai. My kid is having very very high fever, and the moment he gets high fever, we just give paracetamol or whatever Calpol they were giving." So I said, Acha, I was also like little worried about for that kid because he was having frequent episodes of fever. And when I asked what is the temperature, they said 99 पहुंच जाता है, ma'am. It reaches to 99. I tried counseling them. I said, this is not fever, ही नहीं है ये तो. So please don't give any medicine.
What is the thing now? Knowingly or unknowingly, many people, they are just brainwashing the other people. That fever, oh, I heard so many cases, so many people come to, or some relatives, they say homeopathy अच्छा है, but acute case में काम नहीं आता है. बोलते हैं बुखार वगैरह रहेगा तो होम्योपैथी नहीं, फिर एलोपैथी लेना पड़ता है. So this is the way the people think about it. So we have to make them aware. You take any pathy, that is not the issue, but let the body gets fever till 102. It's very safe.
Yes.
And you wait and watch.
When, basically.
Yeah. 102. Generally, after 101, 102, body overcomes on the infection and it started come down. So, I seen 101 is maximum most of the time. But people are getting so panicked after 9900, they just take the crocin and don't allow body to settle.
They just don't let body feels fever or anything happens. They just want to stop it as soon as it comes.
We are paying for that now. We are paying with the other diseases nowadays. At very early stage, you can see asthma, hypertension, diabetes, and so many chronic cases. The neurological cases has increased very at very early age. As I have seen 40 years old lady suffering from Parkinson.
Hmm.
So we are paying with that. We don't get fever or cold coryza, but we get the Parkinson and diabetes and or cancer and all early.
Very true. And what you said about the stages, na, that if you stop this, you will get this stage
Yes,
two and stage three. This is absolutely correct because we are paying very, very heavy prices. Earlier, we used to see diabetes in, sixth or seventh decade or fifth decade. Abhi to 20s mein you can see early diabetes, insulin resistance, and what not. So many things. But it
pretty.
is very important to understand the evolution of the disease, like you said, that up.
First stage of disease should be treated properly, then you can avoid the second and third stage of disease.
Very true. Very true. So thank you so much,
Okay.
Dr. Shrikant. It was really great presentation and very important points you covered. That how to handle it and how, because homeopaths also need to feel confident about handling acute cases. Sometimes log to jo bolte hai, that is a different part, but we also feel inadequate, I would say, that we won't be able to handle. But that's not the reality. If you take case properly, if you like Dr. Shrikant said, you focus on physical examination and what are the reports and everything altogether holistically, you'll be able to definitely deal with acutes in a great way.
Yes, yes.
So thank you so much, everyone.
Hmm.
Just one comment I can see in the chat box. So from Bhumika Kushwa, she's saying, "Sir, I'm a second year student. I want to know that we are normally recommended AK Das to study organon in my college, but is there any other book for students like us to study it practically and understand it?"
See, Organon was very favorite to me in college days. Even still, I read it. So, Organon 6th edition is the must. Ekedas is also a very good book with the point of exam point of view. There is another book by Dr. Sarkar. I don't know exactly DK Sarkar what, but Dr. Sarkar's book is there.
Yes, BK Sarkars.
And then another book by Dr. Bhatia from Jaipur, Dr. Manish Bhatia. He also has written recently has written a book on organon. But if you really want to understand the organon, you have to read it again and again, 6th edition, and the Kent and Robert. These two books also a very important one. But A.K. Das, I know it is not recommended by any teacher, but all students come and read A.K. Das in the beginning. But it's a good book from exam point of view. But you have, if you really want to understand it, then Organon 6th edition. And there is another one is by the Dr. Hahnemann, Chronic Disease. But not in the very second year. You can read it afterwards. But you can start reading Roberts at least and Kent. In a very simplified way, they have explained the organon of medicine concept.
Yes.
Yeah. Okay.
Okay, thank you so much. I'm really grateful to you, Dr. Shrikant, for your
Same
precious
here,
time
Dr.
and
Asha.
sharing. And I would really request you to come up again sometime whenever you have time and share about repertory, because I want to tell you guys that Dr. Shrikant is very good in using different repertories, and he's like a master of using repertories. So I would really want to hear that also from Dr. Shrikant. So we will definitely fix up some other time. And thank you so much for joining in. Please do share your feedback
I
on
definitely.
email, or I would put this on YouTube as well. So wherever you want to share, just put your feedback for sure, and whatever your learnings are. Thank you so much and have a great Sunday ahead. Thank you so much, Dr. Shrikant.
Yeah. Bye. Bye. Bye.
Bye bye.